Chinu Agrawal, I'm coming to you. You're a psychologist, you are a psychotherapist, you are a director of Feeling Minds. Have you been able to make sense of what has happened? There is new information that our reporter is now giving us from Goa, Dr. Chinu Agrawal. She's telling us that Suchana Seth continued to be with the dead body of her 4-year-old, whom she had smothered to death for over 30 hours. This is not normal. This simply is not normal. This is the indication of a highly unstable mind. Have you been able to wrap your head around what has happened and why it has happened?
Yeah, unstable mind is clearly indicated. There is some kind of frustration, which is extreme frustration, which has led her to this kind of action, which we call in psychology, we call it as a relief action, where the frustration aggression theory is there. If there is a goal which is blocked and you want to, release that goal, you take some actions wherein your own mind, your own thinking brain, your own rational brain is not involved, and only the emotionally hijacked brain commands you to do certain things, certain behaviors, which normally, if you would have operated from your rational brain, you would not have done. And maternal filicide has got some known reasons in research. One of them is altruism, where if she's saying, when I was listening to you giving the introduction to this case, you said that she has said that the child was taking treatment from NIMHANS. So sometimes in maternal filicide, they feel that the child will not be able to cope up in this world, and hence they should kill the child. One more angle can be that maybe she was in some other relationship where she thought that the child could be an hindrance, or some other motive she might have had in her mind, where she was perceiving the child as an obstacle and she might have killed the child. That is also known in research. That is the unwanted child theory. And of course, the spouse revenge theory also works over here, where it is known that she was going through bitter divorce proceedings and she might have had a lot of frustration towards the husband, and she wanted to somehow punish the husband by taking away the child. And clearly, she's not in her senses. She's either depressed or she's having some mental disorder, which is either undiagnosed or unrecognized. She might even have a personality disorder. And so this brings to light the sheer, concern of mental health that needs to be brought out through the discussion about this case.
Okay, Dr. Chinu Agrawal, I don't think anyone right now is believing Suchana Seth when she says that she didn't intend to kill her child. It's very clear from the sequence of events she did intend to kill her child, right? She's the one who procures the cough syrup. She's the one who drugs the child. She's the only one with the child in the room. She smothers him to death because that is something that the post-mortem has found, right? The post-mortem has found that the child was smothered to death. Now, so it's very clear that we don't have to believe Suchana Seth when she says that she didn't intend to kill the child. She did intend to kill the child. That is something very clear. Number two, why did she want to kill the child? You have listed many reasons, many possible reasons. The most common reason for filicide is that when a mother feels so frustrated by a certain set of circumstances that she thinks, let me commit suicide, there's no point living. And then she looks at her child and says, if I stop living, if I am dead, who will take care of my child? So let me kill the child as well, right? In this case, Suchana Seth is claiming she did try and commit suicide. But the fact is she didn't commit suicide, right? She didn't die. If she wanted to commit suicide, if you really want to die, there are ways. I mean, she's intelligent enough to know how to kill herself, right? She's a data scientist. She's a Harvard alum. She speaks more than 4 languages. She's a Sanskrit topper. She's a very intelligent person. If she wanted to kill herself, she would have managed to do it. So I'm not I'm not taking this I tried to commit suicide after killing my child very seriously either. As I said, if she wanted to do it, she would have done it. So two things established here. She killed her child intentionally. Post that, there is very little remorse. Where is the remorse? I mean, does that surprise you? No mom guilt, no remorse. You're with the child's body for 30 hours in a room. Then you lie, you manipulate, you flee, you say all sorts of things. There is no remorse. If galti say I kill my child, or if I kill my child intentionally, I would be so racked with remorse and guilt that if I don't commit suicide, I'll go to the nearest police station and say, this is what I've done, arrest me. Right? There is no display of remorse either. I've only seen lies and manipulation, nothing else.
Yeah. So one of the things is that unintended filicide can occur only in one case, where there has been maltreatment or abuse of the child because of own frustration or stress. This clearly doesn't seem to be the case here. Also, as you're talking about remorse, when we talk about the frustration aggression theory, it actually gives the perpetrator of the crime a sense of relief rather than remorse. And that is exactly why the crime gets committed. As far as she not killing herself, see, suicidal ideation and execution of suicide are two different things. And also, one of the things is a person with a mental disorder, a psychotic disorder, when he kills, it is because of some command hallucination where he might be getting some, voices to kill the child, and that crime happens suddenly. But this doesn't seem to be a sudden crime. It seems to be a planned crime, and that generally happens when the perpetrator is in depression. A depressed person, when thinks about killing the child much before the actual killing happens. And she must have contemplated this for a longer time before this actually happened.